Hi, this is Chris Byrne with San Luis Podiatry Group. After successful bunion surgery, it's very important to increase flexibility and range of motion of your big toe joint. After any joint surgery, there's a normal amount of scarring that occurs that can, in fact, limit range of motion and flexibility in the joint after surgery. As a part of the rehabilitation process, it's going to be very important to move the big toe joint as well as rehabilitate the soft tissues around the surgical site. Range of motion exercises oftentimes will start at the first week post-operative visit and consist of approximately 20 minutes of range of motion activities a day in the form of both extension and flexion. What I tend to have patients do is spend 5-minute intervals 4 to 5 times a day focusing in on the flexibility. It's normal to experience pain with any joint surgery in terms of movement after surgery. And it is important to realize that pain in the big toe joint is expected after bunion surgery with regards to range of motion. So if you're not having pain and you're moving your joint, you're not moving it enough. As I mentioned earlier, the scar tissue on top of the joint tends to limit flexibility in the down position. And we sometimes overemphasize the amount of extension flexibility that patients get after surgery. But as you advance into your recovery, usually around 3 to 4 weeks after many bunion surgeries, patients are advancing back into the regular shoes, and the normal heel-to-toe walking will improve extension flexibility. What is limited, however, is flexion. When performing your range of motion activities in your big toe joint, you really want to stabilize the joint. What the surgical procedure has done is focused in on the first metatarsal phalangeal joint. If you are actually extending your toe without counter pressure or support, what's happening is you're moving the whole foot and you're moving multiple joints, including the ankle joint. So what you want to do with your non-dominant hand is stabilize the metatarsal position, stabilize and grab the base of the toe, and as you are extending in an upward position, you're pushing down with your hand. So you're essentially creating a cross pressure maneuver. This will help with extension. In flexion, you're doing the opposite. You're flexing down with the big toe, and you're pushing up and stabilizing the metatarsal to create a flexion force at the metatarsal phalangeal joint. It is okay actually also to distract the toe a little bit because all of the joint tissues and the joint capsule essentially are in a contracted tight position after surgery. So holding the toe in a distracted position for a moment and then going into extension, holding that extended position for 30 seconds to the point of pain and then releasing, and then pulling down, counter pressure up, holding for 30 seconds. And remember, if you're not having pain, you're not moving and working the joint hard enough. Recapping postoperative range of motion exercises, it's very critical to perform the range of motion exercises to have a successful surgical outcome. 5 minutes, 4 to 5 times daily is a general rule. You're certainly not limited to this period of time. Isolating the big toe joint in both flexion and extension is critical to obtaining adequate range of motion postoperatively. This is Dr. Chris Byrne concluding a section on postoperative range of motion exercises after bunion surgery.